Sedatives or hypnotics, such as benzodiazepines, barbiturates, and Z drugs, are CNS depressants. So sedatives and hypnotics. Again, these include benzodiazepines like Valium, Xanax, Ativan, and barbiturates or Z drugs like Ambien, Lunesta, and they can be taken orally or injected. The intended effect is to decrease anxiety or sedation. And effects of intoxication include increased drowsiness and sedation, agitation, slurred speech, uncoordinated motor activity, nausea and vomiting, disorientation or nystagmus. Respiratory depression and decreased level of consciousness can be fatal. So when we think about the opioid crisis, a very high number of individuals who die from opioid overdose actually also have benzodiazepines in their system, and it's the combination of the two that causes death. On college campuses, often we would see alcohol and something like Xanax taken in combination, and that can also cause death through respiratory depression. There is an antidote that you can use an IV for benzodiazepine toxicity. And there is no antidote to reverse barbiturate toxicity. Withdrawal manifestations include anxiety, insomnia, diaphoresis, hypertension, possible psychotic reactions, hand tremors, nausea or vomiting, hallucinations or illusions, psychomotor agitation, and sometimes seizures. So let's talk about cannabis next. Depending on what you read, some people argue that this is a CNS depressant. Some people argue that this is a CNS stimulant. So let's look at the effects of the drug and figure out why. Cannabis. So the other names for this are weed, marijuana, hashish, which is the more potent variety, and it can be smoked or eaten orally. So cannabis ingestion induces tachycardia and orthostatic hypotension. When blood pressure goes down, myocardial oxygen supply is decreased, and tachycardia increases oxygen demand. So marijuana produces a greater amount of tar than its equivalent weight in tobacco. It's most commonly smoked in larger amounts, and tar is deposited into the lungs. And obviously, this is not good for your lungs. So the initial reaction to marijuana is bronchodilation, which facilitates respiratory function, but chronic use results in obstructive airway disorders. Frequent marijuana users often have like laryngitis, bronchitis, cough, hoarseness. It contains more carcinogens than tobacco smoke. Some studies show with heavy marijuana use, men may have a decrease in sperm count, motility, and structure, and in women, it may suppress ovulation, disrupt menstrual cycles, and alter hormone levels. When people report feeling high, that they have feelings of euphoria, relaxed inhibitions, they may feel disoriented or depersonalization, and relaxed. So the intended effects are euphoria, sedation, sometimes hallucinations. And for individuals that have chemotherapy, they use this drug to decrease nausea and vomiting and to increase appetite. It also can be used to manage chronic pain. Intoxication, like I was saying, for chronic use can include things like lung cancer, chronic bronchitis, and other respiratory issues. And high doses, we might see paranoia, delusions, hallucinations, increased appetite, dry mouth, and tachycardia. Individuals who are going through withdrawal may have increased irritability, aggression, anxiety, insomnia, lack of appetite, restlessness, depressed mood, abdominal pain, tremors, diaphoresis, fever, or headache. So toxic effects are when individuals have like the panic reaction, They can also have red eyes, muscle rigidity, and very heavy use can cause acute psychosis. I read once that 15% of schizophrenic breaks are caused by marijuana. Now, historically, marijuana kept you from becoming psychotic, and the new version of marijuana is actually more likely to cause you psychosis. So when we alter chemicals and things that we grow, if you think of like with crops, like GMO seeds, then the outcome changes. It's not always positive. When we think about the nursing process, we think about ineffective denial, ineffective coping, imbalanced nutrition, fluid deficit, people who are drinking alcohol instead of eating, risk for infection related to malnutrition, deficient knowledge, so they don't know what they're doing to their body. And for clients withdrawing from CNS stimulants, they have a risk for suicide related to intense feeling of fatigue, so lack of energy and depression. They crash. We worry about suicidal ideation. So keep that in mind as we're going through these lectures. Central nervous system stimulants. These will include cocaine, amphetamines, and nicotine. The CNS stimulant is dependent on the area of the brain or the spinal cord that's affected by the drug. So keep that in mind as we're going through these. Cocaine, a central nervous system stimulant. Cocaine can be injected, smoked, or inhaled, so snorted. And individuals who do this get a rush of euphoria, so extreme well-being and pleasure, and also increased energy. They may feel dizzy, irritable, tremulous, or have blurred vision if they have mild toxicity. And if they've used quite a bit, then they'll have severe effects, which may include hallucinations, seizures, extreme fever, tachycardia, hypertension, chest pain, possible cardiovascular collapse, and death. Individuals who withdraw from this medication may experience depression, fatigue, craving, excessive sleepiness, or they may have insomnia, really unpleasant dreams, psychomotor retardation, or agitation. So either moving too slow or too fast. And they might have suicidal ideation. Amphetamines, a central nervous system stimulant. Amphetamines can be taken orally, injected intravenously, or smoked. Their intended effects are increased energy, euphoria, similar to cocaine. And when individuals are using this, they may experience impaired judgment, psychomotor agitation, hypervigilance, extreme irritability, acute cardiovascular effects like tachycardia, elevated blood pressure, which could cause death. Withdrawal manifestations include craving, depression, fatigue, and sleeping, and withdrawal from it is usually not life-threatening. Tobacco, central nervous system stimulant. Tobacco can be inhaled, snuffed, or chewed. And nicotine affects like the nicotinic receptors in the brain, the carotid body, the aortic arch, and CNS. So activation of these receptors can simulate the action that occurs with cocaine and other substances. Often with tobacco, we think of cigarettes. So cigarettes and cigars are inhaled. Smokeless tobacco is stuffed or chewed. And people say it's relaxing or it decreases anxiety. It's highly toxic, but acute toxicity is really only seen in children when exposure is in nicotine and pesticides. So children who are exposed to nicotine and pesticides, it can be toxic. It also contains other harmful chemicals that are really toxic and have long-term effects. Some of these effects include cardiovascular disease, hypertension, stroke, respiratory disease, emphysema, lung cancer. With smokeless tobacco, they have irritation to the oral mucous membranes, and they get cancer of the mouth. Abstinence syndrome is evidenced by irritability, craving, nervousness, restlessness, anxiety, insomnia, increased appetite, difficulty concentrating, anger, and depressed mood. Now we're going to talk about other addictive substances, which include opioids, inhalants, and hallucinogens.
But first, take a quick break because that's the end of this portion.